All right, today we're going to talk about how to get stable for local anesthesia injections. So first step is we want to be properly positioned as an operator. So I want to be sitting in my chair with my feet flat on the ground and being able to sit comfortably in the chair. So I don't want to be like perched on the edge like this. That's going to make me unstable right from the get-go. Or sitting like this, or any of the other funny ways you could sit. So we want to be really nice and stable in the chair from the get-go. We're also going to position our client properly. We'll do that once we have a client in the chair, but we'll want to position them so it makes it easier for us and for them. We're going to use their bony landmarks to get our fulcrums and stabilization and retraction. So we're not just trying to float on some of the buccal mucosa or something like that. We're actually finding like the mandible or the zygomatic process or zygomatic bone or bony landmarks that are going to help really give us something firm to rest on. Also, we are going to keep our elbows in and our palms up when we're doing all of our anesthesia, as much as possible. By doing that, I'm going to keep from bringing my elbows out and my arms up and away. This gets tiring really fast, even if I don't have anything in my hands. If I've got my elbows tucked in, they can kind of almost rest on my hip bone if I need to. And in any case, it's going to be much more restful for me to keep my arms this way. Also, my syringe will be able to rest on top of my palm. So I can even support that without any effort. So that's going to make it easier to stay stable too. Instead of if I'm turned like this, now I have to focus really hard on not dropping that syringe. It's pulling down. My arm is getting tired. So overall, if I turn elbow in and palm up, that's going to give me a much more restful injection to be able to do and greater stability. The other thing I'll do with my syringe is I'm going to be able to grasp it mostly with my 2 fingers. So I can even take my thumb right out. That'll keep me from dripping anesthetic all over the place. And then I can rotate from my fingers, right? So rather than having to rotate from my shoulder to get an angle, I can leave my elbow in and rotate from my fingers to get an angle. So that's going to give me greater stability again. Takes a little more getting used to, but it's really worth it. We're going to try and get fulcrums as much as we can with our pinky finger to help stabilize. So let's say I'm resting on the client there, something like that. But there's other ways we can stabilize too, so we'll see a whole bunch of those. The other trick we have is we can use gauze for our retraction if you've got a lot of saliva with your client. If they're pretty dry, you don't really need to worry about it, but if they have got a lot of saliva, you can't get a good grip when you're retracting sometimes. So we'll fold up this gauze into thirds. So it makes a nice thin strip that's about the width of your finger. And then that way the gauze won't get in your way and you won't cross-contaminate your needle tip. So I can fit it right underneath my finger or my thumb that I'm retracting with, and it stays pretty hidden, but it gives me a good grip. Kind of like a non-slip pad. Alrighty, that's our fundamentals of staying stable. We'll get into some actual injections and landmarks and techniques.